Happy Saturday. It's time. It is time. Let's get into it. How are you guys doing? It's been a while. Sorry for being a few minutes late. Um, Today we are going to be talking about the top 5 things that you need to talk to your partner about. Seriously. And for those of you guys who have followed my channel, seriously, you're going to love it. You are going to love it. Okay. Let's see.
Seriously?
Just trying to do a little sound check. Okay. Let's see. Perfect. I've missed you guys so much. Okay, let me just do a sound check. It's Saturday, which means we need to get into it. So today we're going to be talking about the top health topics to discuss with your partner. And honestly, if you followed my channel, part of this has been, similar to what we've talked about in the past. This channel is really about empowerment and using healthcare to empower ourselves and make it easier for ourselves rather than, being like kind of victims, for example, to it. Okay. So again, it's me, Dr. Ivie Okendaye Apia, and you're in for a treat definitely on this channel. I'm going to go ahead and put the link in the chat so that you guys can, comment or join in. Okay, it's in the chat. Perfect. So welcome to my channel. I'm going to allow some of you guys to trickle in, but welcome to my channel. My name is Dr. Ivie Okendaye Apia, and I'm an internal medicine doctor and nephrologist, meaning kidney specialist. So I deal with adult medicine, and really my passion is to try and support and help empower ourselves, in particular for those, who feel kind of lost in the system. I just want to help demystify and basically just empower ourselves on all things health and wellness. And really the point of my channel is just to share with you that you are worth it, that these sometimes hard conversations that we need to have is absolutely worth it, okay? So on your way in, as you guys are trickling in, make sure to subscribe if you haven't already, like the channel, or hit the thumbs up and share with other people if you find this to be helpful. And the reason I say that every time is because it helps to show that the channel is growing, okay? So basically what I'm trying to do is grow the channel, and it lets YouTube know that, hey, people are interacting with this channel, and it helps to support my channel being supported with you guys. Okay, so we got some people in the building. Hi, good morning, Silver Diamond. How are you? Thanks for joining us today. Grand Rising, beautiful. Oh, thank you. Grand Rising to you too. Thank you so much. To be Black Native, she's awesome. Always here. Thank you so much for your support. Oh yes, and one nurse, Courtney. Hi. Wow, I love your picture. All of the pictures, but wow. What lipstick color is that? It's almost similar to the one I have. But hello, everyone. Thanks so much for coming in. So we're going to go ahead and get started. Again, like, share, and follow me on Instagram if you haven't already. Do that. Do that. I just share some, personal. I'm going to get more personal too on that on my Instagram. But I'm warming up to it. But yeah, thanks guys for rocking with me. Last weekend was just really crazy, and I had a lot of stuff going on, although I always do. But this channel is growing, it's evolving, and I definitely want your support. I want your support, okay, for topic suggestions or ideas, is anything that you guys want to learn more about. Because honestly, how I was really introduced to a lot of you guys on this channel was just more so through our love for reality TV. And I've been on multiple platforms just because of that common love. So that's probably where I've gotten a lot of my newest followers, like in the last 6 months, 9 months or so. But yeah, really what I'm trying to accomplish is just like, hey, how can we use health information in a meaningful way to improve our lives and to make things easier? I know for me, sometimes I felt like a victim, almost like, oh, they're doing all this stuff to me. And no. I want to be able to use my medical knowledge, medical training to give you guys information so you can make informed decisions for yourself. That's my only goal. So in the past, for those of you guys who have followed me already, in the past, we've talked about a lot of things. Very, very beginning, if you go back to my early videos, I was recommending that we wear masks before the CDC was recommending it. Because you remember early on in 2020, there was a question about, should we be wearing masks or should we be saving that for healthcare personnel? I was saying, go ahead and wear the mask before the CDC said it. I've talked about, COVID, why there's increased risks in, people of African descent. And I think I'm going to go and revisit that, especially with everything that's been going on with the Delta and Lambda variant. And then just as a reminder, I also have encouraged Black women, everyone, but in particular Black women, Black people, to pursue medicine, and why our innate life experience, I think, just qualifies us. So I'm just speaking in particular for Black women's experience, and honestly, Black people, and just in general, honestly. Now, this channel it's not exclusive. Everyone can listen to it, but there are moments that I'm going to be highlighting certain groups, right? So you know what it is. So anyway, so I just say all of that to say, welcome back to my channel, a refresher on things that we've discussed in the past. And we're gonna get it started. We're gonna get it lit. Like, for example, I think in a couple weeks we're gonna be talking about medical cases, because I have a lot of people who really want to go into medicine or who have interest in like health careers and things like that. I got you. And you know what? We're going to go over some medical cases just to stimulate interest. Sometimes things are a little bit intimidating, but no. On my channel, you can do it. I'm telling you, anyone who watches my channel and you're interested in medicine, you need to let me know. You can put a thumbs up in this chat if you're in here, or you can message me and I will help you. I've already done a few consultations or interview practices for interviews for med school or just advice in general. And trust me, you can do it. Okay. One nurse Courtney. Hi, everyone from LSW. Hi, LSW. Good afternoon. Thank you so much for joining us. Okay. So anyway, just welcome back. I've missed you. Let's just, get things going. I have a lot to talk about with you today. Hopefully you find this to be interesting. Today, we're really going to be talking about the things that you might be avoiding, discussing with your partner, and why it's relevant like now, like today. And I want to hear your feedback and your opinions, okay? Because I'm just going to get into it. It might seem a little bit crazy, but I think some of you guys who have watched me for a while, I don't play around. Not for the people who watch this channel. I support the people who watch this channel, and I'm just going to give it to you real from my perspective, okay? And if you have any questions, you call me, IG me, DM me, whatever, and I'll help you. Okay, let me see. Okay, let me go ahead and get this started. Oop, okay. Do you guys like my thumbnail? Hopefully you can see that. Yay. So the top 5 conversations you need to have with your partner now. Okay. Does anyone know the name of this movie? I got this title slide from a movie. If you know it, you can put it in the chat. I remember watching this movie and just loving it. Like, it was just so fascinating, and I thought like their facial expressions just expressed everything, Well, what's he thinking over there? Or what's she doing over there? Guys, sometimes these health conversations are they're just, first of all, so important and honestly key to intimacy. If you can talk about health topics, you can talk about a lot of other things, and I'll get into it, right? So let me just dive right in. Number 1, sex and STDs. Okay, so this information is relevant to anybody. If you've been married for 25 years, this is relevant. If you've been seeing someone for 25 days, this is relevant. If you're in a fluid situationships, we're talking, we're doing whatever, this is relevant. Okay, so my first point is that topics about sex and STDs, for those of you who are in intimate, sexually intimate relationships, I think this is relevant. I think for you as a man, as a woman, as a person, you need to define for yourself, what are the boundaries of the relationship? What is a relationship? Are you in one? And then the sexual relationship. And so part of this is monogamy. I've been seeing on TV, look, there's so many, people swap in, swap out, do whatever. There's no judgment, but protect yourself. Number 1. Number 2, can we just be honest about sexual positions? There's something, I'm going to go there. There are some things that are, considered traditional sexual positions, and then there's some things that may be considered more just different. For example, anal. And the reason I bring up anal is because certain positions, including anal, increase your risk for certain types of STDs, right? So you need to know if the person you are, what you're comfortable with and what you're not. Of course, people evolve, grow, or, decide, hey, I'm into this or I'm not into that. And you have a right as a person. I just want us to be clear about what that is for yourself, and then be able to communicate that to your partner. Maybe 20 years ago you were into something and then now you're not. Actually, the person that just popped into my head is, from Real Housewives of Potomac. You guys know I love that show. From Real Housewives of Potomac, you remember Ashley talked about how in the past she had like doing certain things, and then now in the context of a marriage and being a mom, no, she's no longer interested in doing those things. I think that's an important conversation. I was just so shocked. I was shocked. I mean, that's not that she feels that way, but that she shared that information on screen. So what I'm trying to say is, look, guys, if you have certain feelings, please communicate that with your partner. If there are things you're really not into, let your partner know. And it's important to establish that level of boundaries. That creates safety, emotional safety, sexual safety for both parties involved. I hope that that's making sense, and that you guys actually are feeling what I'm saying. Let me just see what you're saying in the chat here. Oh my God. Hi, BJ Des. Thank you so much. Yeah, you guys are agreeing. Okay. So the second part of this is STDs. Okay, here's what I want to say about STDs. STD meaning sexual transmitted disease or sexually transmitted infection. In my opinion, this is just for me as a medical person, any part of the body can get infected, including your reproductive organs. Can we just be honest? It doesn't have to be this big, blown out thing. Just get checked out. For those of you guys who have followed this channel, you know what I'm going to say, right? Anytime you're in a new relationship, just get a fresh checkup. Or if you're ending one, hey, every time there's a reset, you hit the reset button, reset on your screening, and don't feel awkward about it. There's nothing wrong telling your doctor, oh, I want to be tested for STDs. They're honestly, they're probably going to applaud you, if anything. No one's going to be like, oh my God, ew, like, what were you doing? Absolutely not. It should be normalized. There's nothing wrong with it. So I've actually had people tell me, oh, I just don't want to be judged by it's like, you should not feel judged by the doctor. This is what they do. But if you don't ask for it, they may not bring it up. See, for me, for my patients, I like to get into people's business, not for me, for you, for my patient, because I want to know, what are your health goals? What are your true concerns? There's some things people don't ask or they're shy to ask. Can you relate to me? I know I've actually had that problem myself. You're in the waiting room or in the clinic room, and then you're really here for one reason, but you say something else. Can we be honest? Has that happened? And then it's like in the last 5 minutes, you're like, oh, wait, there's just one more thing. That one more thing is the very thing you might be there for. Don't worry. Just what I'm trying to encourage you to just be aware of is that it's no big deal to get screened for STDs. And this might be in particular for the younger viewers, the young people. There's nothing to it. So that's number one. Anytime you hit the reset button, new relationship, new sexual partner, just get tested. It's not a big deal, and it's worth it. Just so you actually know on, what is today's date? August 15, 2021, I was negative. So if anything pops up in the future, you have a reference point. It's like, oh, where did I get this? When did this happen? There are some caveats. Where there are some like few exceptions. I'll just say that. Okay, I'll just leave it at that. The second thing I'll say is, you may want to discuss with your partner, have you ever had an STD and an incurable STD? STDs, like chlamydia, you can just treat. It's a pill, guys. It's a pill, and you move on. My concern, though, are for people who have like incurable STDs, those that you have to live with for the rest of your life. The number one being HIV/AIDS, right? You guys have absolutely heard of HIV and AIDS. People ask me, okay, well, what is really HIV? It's a virus. It's a sexually transmitted, very powerful virus that unfortunately mutates a lot. That's why we don't have a vaccine. For those of you who believe in vaccines, anyway, that's why we don't have it, because the virus mutates so much. But it basically just destroys a person's immune system. Then AIDS is a more advanced version where your immune system is so compromised that you're at increased risk. For both of them, you're at increased risk of really some serious infections, and AIDS even more so. It's a reflection of how many immune fighting cells that you have in the body. And there's some other criteria. But anyway, it's important to know, because if you get involved with someone who has HIV/AIDS, you're at risk of getting it. And there are some medications that help partners of HIV positive patients protect themselves, so that you can actually have sex with someone with HIV/AIDS and protect yourself from getting it. In some male or gay male communities, this is more widely understood or more commonly understood. Of course, anybody, any race, anybody can get HIV/AIDS. But again, the situation, the issue is, anal increases risk of bodily fluid contact, even more so than just traditional sex. But anyway, I just say all of that to say number one, know yourself, know what you're comfortable with. What is a relationship? Are you seeking that? What do you want? And then the second thing I would say is to always get tested for STDs. And you need to know if your man, your woman, whoever your partner has HIV/AIDS, or for another one is herpes. You may have heard of genital warts or genital herpes. These are just a situation where you can get outbreaks on the genitalia. Yeah, and it can come and go. It can come and go. And basically, these people need to take a medication to suppress this reactivation. And it's hard, but you need to know that if your body is at risk, then you need to know that. So that's the first thing, is sex and STDs. You guys need to talk about it. Thanks, one nurse Courtney. The second thing is pregnancy and family planning, if relevant. I'll speak to the women first of all right now. Women, this is relevant if you're interested in men, if you're interested in women, or if you're interested in both. There is always risk of pregnancy if you're in a male-female situation. Even for those who are women who have women who have women partners, you may still want a family. And there are, different, maybe non-traditional things we would have to do to support your family planning. Either way, everybody needs to understand their own family planning and pregnancy plans. And so part of what I'm saying is, it's just something, if you can get a period, you can get pregnant. We've talked about on our channel in the past, that the risk of getting pregnant, the chances of getting pregnant actually get lower in more advanced ages. And so, I've encouraged, if you're interested in pregnancy and in starting a family, I've encouraged women to try and do that before the age of 35, only because the egg quality goes down and the chances for an abnormal pregnancy go up. I'm talking purely from a reproductive health standpoint, not from a financial standpoint or, anything like that, especially for, some of you career women, of which I am. So yes, I'm talking to people like me, and that's honestly, anyone on this channel, anyone who wants a family, consider that. And you need to, of course, it takes two to tango. You need to discuss that with your partner. So, women I believe, have a right to know what their own family planning and pregnancy plans are. And a lot of the times that we women have to sometimes be in charge of that or be cognizant of that, because of course, the clock is ticking for the reasons I described before. Now, to the men who watch this channel, and a lot of you do, a lot of amazing men do support this channel, which I love. To the men, I'm talking to the men right now, you also have a right to have your own plans, right? And of course, it takes two to tango. But, if you're not interested in a family right now, or the time is, you need to discuss with your partner, are you on contraception? If you're sexually active, are you on contraception? And honestly, dare I say, can I see it? Let's just be honest, because you need to feel, comfortable and confident. So, there are certain things that I'm going to be emphasizing to men versus women and vice versa. But this is really relevant to anybody. And for the women, you can say to your partner, literally, quote, if I were to get pregnant, what's our plan? Okay, in this country, most pregnancies are desired but unplanned. And there's a lot of data about this. I've seen data saying approximately about 50% or even higher of pregnancies in the US are unplanned but desired. So, most people are like, ooh, surprise. It's not that they were necessarily trying. And that's completely fine if it's, if desired and everything. So, this is something that could literally happen to anybody, even if you weren't necessarily expecting it at this point. So, have a plan with your partner, and I think that would be really helpful. And then, just down the road, if you want children, if so, when, and then just plan accordingly. Okay. Number 3, medical history. Nurse Courtney probably knows. Yeah, I'm sure knows what I'm talking about. People say, okay, if I ask someone, what is your medical history? People may not necessarily know what I'm talking about. What I'm talking about are, what are the diagnoses a doctor has given you? Do you have any illnesses? And sometimes I forget, I forget, like, oh, something happened in the past, but I may forget to mention it. Another way to ask your partner is there anything you see a doctor for regularly? Another way to ask your partner is, do you take any medications regularly or even as needed, and for what? Now, of course, you have a right to, privacy, and, medical information is private. I'm talking for situations where I want people to at least consider this. If you have a live-in partner, I would say, discuss medical history. Consider discussing medical history. Why? Because your partner should be a support system for your health issues and for your life. If you're in a relationship, or you could have a partner or life partner, whatever, there's a reason you're spending time together, and it should bring out the best in each person. Sometimes the health issues we face can be so debilitating, can make us very vulnerable. And having that extra person at home who likely sees you all the time, should really be a support system and add to your life. That's what I'm trying to say. I also have seen that when 2 people in a relationship talk about their medical history and health issues, I feel that it actually helps to facilitate communication in other areas of life. Okay. So I just wanted to do a check. Have you experienced that? Has anyone experienced that? You don't have to tell me details, but have you discussed, is this something you guys do? And what has been the reaction? Okay. So I'm just saying here in this middle section, the importance of having this discussion with your partner about just your medical issues in general, especially for people who you're actually living together, because emergencies oftentimes happen at home and at work. That's why they have you fill those things out. When you're in employment or at school, they sometimes have you fill out, okay, what are your medical issues? Of course, you can't be discriminated against because of it, but sometimes it's helpful to be aware if you have an arrhythmia or irregular heartbeat, or you could just pass out if you're overheated, or something happens. You could. So to be aware of these issues, I think helps to facilitate communication about other life issues and other responsibilities in your household. This also relates to the prior point about how this may actually influence pregnancy planning, especially if it's genetic. And I'll give an example. Okay, sickle cell disease. Okay, this is relevant primarily for my Black audience, the people who support me who are of Black African descent. Okay, as you know, we've described this. About 12% of people of African descent, 12% or 1 in 8 actually have a gene associated with sickle cell trait. Okay, and if you acquire 2 copies of this gene, you actually can have a classic full-blown disease that can actually impact your body, and it's typified by pain crises, sometimes heart problems, kidney problems. And what happens is that the red blood cells start to sickle or change shape, and it's worsened by having low oxygen, and it can get worsened when there's low oxygen flow. So these irregular red blood cells can actually cause issues okay? And it's worse and can cause pain in the body. So a lot of people have heard of it. There are different flavors of sickle cell disease, but if you are dating somebody who has the trait and you have the trait, just know that 21 in 4 of your children may actually have the disease, assuming that you don't have the disease. So just keep that in mind. Now, if you have sickle cell disease, you will pass that trait on to your child, and I think your potential child's parent should be aware of that. And there's sometimes genetic counseling that's involved. So I say all of that to say you need to know. I mean, shoot, I ask. I'd like to know. Then the second thing I would say is examples of, I'll just go with the hypertension, high blood pressure. Of course, you guys know that leading cause of death in this country is heart disease, heart attack, and stroke. High blood pressure is a large risk factor. They associate hypertension as one of the risk factors for being a silent killer. Hypertension increases your risk of stroke and things like that. So remember, at least for my patients, what I do is I like to encourage them to have a low salt diet. That really will help for most flavors of high blood pressure, having a low salt diet. You might need to let whoever does the cooking in the house know. If one person likes to pound on the salt and the other doesn't, that's going to create an issue, right? So I think having that synergy in your household, in your relationship, to know these are the things that are important. My doctor's recommending a low salt. These discussions are invaluable, okay? Because if I make a recommendation in the clinic and it's not implemented at home, it's a waste. If I give you a prescription and then you can't fill it, then it's not helping you, right? So I'm just encouraging people to have those intimate conversations about your medical history as you feel comfortable, but I'm trying to encourage to say, hey, you can do it, and it doesn't have to be this big, dramatic, scary, awkward thing. Just lay it out there. Okay, I would be remiss, 2 more examples. I would be remiss to not talk about COVID, okay? Oh, you're amazing to be Black Native, hypertension currently, okay. I would be remiss because that's the era we're living in a modern society. This is what we're dealing with. I probably will do an update video about all this, new stuff post-vaccine, right? We have, the Delta and possibly Lambda variants, and what does this all mean? I think it's relevant to know if your partner is vaccinated or not. I think it's important to know if your partner believes in masks or not, because there's a lot of variation in this country, just like with politics, right? You have your Republicans, Democrats, independents, or whatever. And sometimes it's a reflection of your values. But I say this as it relates to COVID because, we are a product of our environment, and if you're living with somebody who may be unvaccinated and you're also unvaccinated, there's a potential risk there. This talk is not really about vaccinations. Do they work or not? That's a different issue. The updates with the Lambda, Delta, and all of that, what's going on, I can do in a separate video. I'm just saying in 2021, this is clearly taking over the world. We are still in a pandemic with multiple waves. And I just want to encourage people to protect themselves at home. And the people who are at home is your family and your relationship at home or in your social life, right? So I just want to know and be careful that we actually protect ourselves from COVID, and that's what I will say. Are you living with someone who's at increased risk for COVID? My husband is in healthcare himself, so that's something. Hey, I need to. Hey, every day, right? So there's that increased risk. But these things are so highly transmissible that kind of everyone is potentially at risk, regardless of how you feel about the vaccine. We know that COVID deaths are rising. I'm literally getting emails every day between you and I. I'm literally getting these emails literally every day asking for people to come, for physicians to come and work because of the increased COVID hospitalization. Literally, I'm so like kind of honestly devastated by it. It's terrible, but it's giving me literally flashbacks from last year where we didn't have enough beds. There are hospitals that are starting to not have enough beds all over again. And there's some thought that it could be related to unvaccinated people and young people. So that's just my concern. I still believe in masks. I know that there are different areas of the country that don't require it or it's recommended. But with what's going on, consider wearing a mask. They do work. It protects you as the person and people around you. So it's not perfect, but I'm just saying that. And then of course, hand washing decreases your risk. Yeah. So, everyone has their different thoughts, and I respect it. This is not to get into a debate about if vaccines work or not. I know the science, but this is not really a debate. I'm just giving you information, and you can do what you want to do with it. If you decline vaccination, understood, that's your right, of course. And there might be reasons, medical reasons, why you may not. But discuss with your doctor, discuss with your partner. That's all I'm saying. Okay. And I'll get into your comments in a little bit because I see that you guys are saying some amazing things. But I will finish up with number 5, my last final tip, which is mental health. And as it relates to your own well-being. So these are the things I would recommend asking your partner. Listed there. Okay. So you know what? Mental health issues are extremely important. Honestly, we talked about this last time. Simone Biles is one of the most physically healthy people on the planet as a gold Olympian, right? But she was citing a health issue, being mental health. And so mental health is part of health. It's a large part of it. And boy, when things are not good, that can really consume your entire life. Okay, and life happens. We all have, daily stressors and things that can, flare us up or stimulate us, but how do we recover and cope? And oftentimes your partner is the first person to see things that you may not see. Just being honest. Just being honest. You know how you can see somebody at work and say, oh, they must be so nice, they're so wonderful. And then, you can ask their spouse, how are they really? People at home, who really know you, they're going to know aspects of you that you probably don't even know about yourself because they're observing from the outside, right? It's funny. Sometimes our own mental health or how we cope is our own blind spot. For example, can you see your nose? I can't see my nose, maybe like a little bit. But, if I see somebody else, if I look at my partner, I can see his nose, right? There are some things that are part of us that are so innate to us that we don't even see, but it's obvious to somebody else. That's all I'm saying. And mental health is one of those clear arenas that we can really, talk to each other about. I think part of it is having an understanding and self-knowing and self-discovery. But you can ask your partner, when you're feeling down, how do you cope? I sometimes I don't even use words like depressed because depressed may sound like serious or, intimidating or like a diagnosis. But when you're feeling low or feeling bad, how do you cope? Okay, so if that person is telling you, oh, I just drink it away, like, drink my problems away, or I drink. Here's a big one: the people who cannot sleep and use alcohol to sleep. Oh my gosh, that is a big one. I'm telling you, it happens. There are people who truly have difficulty sleeping for whatever reason, who use alcohol, it's a depressant, to go to sleep. And that's so sad. That's a problem. And that's an indication of a larger issue. It's a problem. And I can help. These are things that I've picked up on, I've seen so many times, but that's an important clue or cue. You can ask someone, oh, do you do drugs or do you do alcohol? And they may not tell you. So here's another way to say it. Have you had any issues with alcohol or illicit drug use? Have you gotten into trouble because of alcohol or illicit drugs? Have you been to rehab? Can we be honest? Sometimes you have to ask the question in multiple ways. Like sometimes even a simple question, are you single? People, does anyone think they're your boyfriend or girlfriend? Because, hey, you ask me out on a date and then you find out, oh, this might be a different situation. You assume things, but if you don't ask, to me, what is it? An omission is a lie. A lie of omission is a lie to me. As I know some of the ladies in the chat can feel what I'm saying. Shoot, men in the chat can feel what I'm saying. But anyway, I think mental health issues are important because we all want to be a support system for each other, but sometimes knowing in advance how to handle each other is extremely important. So that's really it. Okay, those are the 5 things I really wanted to talk about. Sex and STD prevention and treatment, pregnancy and family planning topics, your medical history, COVID, vaccines and masks, and how you feel about that. And then lastly, about mental health. That's really, the major issues I wanted to discuss with you guys today. What do you think? Did you like that? Okay, so let's see what everyone has to say. Yes, BJ, love it. Okay, says okay. I think you were saying that in relation to, I forget, I think that was around the time of maybe talking about medical history. Hypertension currently, yes. Yeah, one of the number 1 killers. A leading killer, actually. Yeah, of course, it's heart disease and stroke. Hypertension is part of that. Okay, so let me see what you guys are saying. So BJ does, yeah, this is true because I never thought I would marry someone who smokes. I have asthma and other breathing issues. Are you currently married to a smoker? Do you mind me asking? It's funny because I actually have asthma in my family, and actually I had childhood asthma that I outgrew. And in our house, we really couldn't have like certain pets because they can stimulate the immune system and can generate, a molecular response in the body that triggers asthma. I know like sometimes bunnies, I had a family member literally like have an issue with certain bunnies, certain animals. I want to know more about that. Yeah. And of course, I would encourage smoking cessation for anybody. Just for lung cancer, risk reduction, for heart disease, for just your overall quality of life, breathing. Oh, don't need it. Okay, so she said, I understand. BJ Des says, I understand I'm not vaccinated and neither is my husband. He came home yesterday and told me he was exposed to one of his workers that tested positive for COVID. Okay. At least he was informed. You know, I at least he was informed, and now you know your own risk. So maybe you might take certain precautions, like maybe not go out as much, continue to wash your hands rigorously, wear masks for maybe a time period, and just be really vigilant. Like any new feeling off, feeling tired, feeling fatigued, not even cough, fever, even just the slightest thing, just, you're aware that that's what it could be. Okay, let me see. I'm guilty of that. I would say that when it came to alcohol. What is that? Going to sleep? Yeah, alcohol is just one of those things. Of course, the occasional drink is fine. There are some recommendations for how much men and women should drink. On average, no more than 2 drinks for a man or 1 drink for a woman. And you guys talk about this sometimes. It comes up. Like if you guys are going to a party, have you heard of that like 2 drink maximum rule? You just don't want to you want to turn up but not like go crazy. Yeah. Sometimes, you need to know you need to know. Like, for example, if your partner just gets completely wasted and he or she is supposed to be your DD, designated driver, then now your whole safety is compromised. Or you have to, get an Uber. Don't drink and drive. Just don't do it. I know there are different legal amounts per state. And everybody metabolizes alcohol differently, but just know your own limits, and the limits for your partner, I think, is good. Some days you want to do whatever you want to do, but in certain contexts, if you want to turn up and whatever, do more than your usual, then maybe you should be doing that closer to home or in your home, in your own vicinity. Do you know what I'm saying? I think there are ways to take measured risks. I can't say no to anything. I'm only saying if you're going to do this route, do it this way in such a way that it protects yourself. That's how I live my life. That's how I, encourage my patients, because everyone is a human being. They have a right to do whatever they want. Whatever you want to do, that's fine. Let me help you do it in a healthy, least damaging way to your body, mental health, and let me share with you some of the consequences. And honestly, sometimes we live our own consequences. Straight up, yeah. Okay. Yeah, but okay, if to the person talking about alcohol, when it comes to alcohol, yeah, alcohol is a depressant. Cocaine is a stimulant. So cocaine, causes like systemic throughout the body vasoconstriction. It can, meaning blood vessels get tight, and it has certainly effects on the heart. It stimulates people. Have you seen people that, they're like so energetic at like 6 a.m, have done so much stuff? You could make a joke, oh, like, what are you on, crack? No, but as a joke, but there's a reason behind that joke. It's because it's a stimulant. Alcohol is a depressant. It just slows things down. Of course, you know that with like driving. That's why it's not encouraged, because your mind processes things slower. Your reaction time may be slower or impaired, so it puts you at increased danger. And I'm sorry, guys. You know me. I like to talk science. Hello. I will talk science, because a lot of you guys, you're not looking for just generic information that you can Google. You want like the real information in a accessible way. But I'm also what makes me different from other channels, in my opinion, is I'm gonna give you the data, the science behind it, especially because a lot of you guys are really interested in medicine or healthcare, or are healthcare professionals yourselves. I mean, there's at least one nurse here right now in the chat, and then many physicians follow me. So I just talk like I would talk to a colleague. And if anything doesn't make sense, just let me know. But I try to, define terms and not use, not try and be, difficult to understand. But if there are any questions, just let me know. But you know me, I give it real. We go over charts, we go over data, because you guys don't play. You ask more questions like, wait, tell me more about this, or, how these number of people died after a vaccine. What does that mean? And we've gone over the data. We don't play over here. Okay, so next. Okay, so one nurse, Courtney said, I agree. Oh, thank you. Right, I think that was in relation to the comment about alcohol, possibly, and then, using alcohol to sleep is a problem. It's a problem. And I sympathize for people who have difficulty sleeping. Honestly, I do. I really do. Here, I'm going to just put this in the chat for anyone who may want to come in or comment. So, yeah, okay. So, yeah, I honestly, I sympathize for anyone who has difficulty sleeping. Why? Because sometimes it's just insomnia, or it is what it is. Or it could be more complex, like, you can't turn off your brain, that you're always stimulated during the day and have difficulty transitioning off. I know I'm trying to get more into a healthy sleep routine, and there's actual data and science behind that. Like, there are people, including at times me, that I just wake up the next day. It's not like I have put away my computer, my laptop, my cell phone, and organize myself to go to bed. I just have fallen asleep and wake up the next day. Do you understand what I'm saying? Oftentimes that's not restful, because your mind has not taken the time to turn off or slow down. And over time, there's cumulative effects on that. Seriously, you need time for your brain to decompress. And that's why, honestly, time management is extremely important, and self-care is extremely important. What are you doing for yourself during the day what are the 3 words I always say? Renew, rejuvenate, and replenish yourself. Part of that is having a spiritual practice that does not involve just, I'm tired, just, I happen to fall asleep. Part of that is knowing, who you are, what are your values, and gaining clarity. So you need that time to yourself. There should be a piece of you that's for you. You give yourself to your spouse, you give yourself to your job, you give yourself to your children. I know moms, dads give everything that they have to their children. There needs to be a piece of you left for you, untouched. And part of that is having protected time for yourself. That's how I see time management and self-care and, your whole health and wellness as very much linked, because we have to create time and space for that. Oh, sorry. I could go off on tangents, but they're all related. And that's the basis of this channel, really, is self-worth and valuing yourself. If you value yourself, you would want the support from your partner to help you. Example, case in point. I've said this before on my channel about asthmatics. If you know what I'm going to say about asthmatics, put it in the chat, please. But for those of you who are new or newer to the channel, I'll tell you what it is. Anyone who's an asthmatic or who has asthma, I encourage them to have multiple inhalers. Even if the asthma is well controlled, multiple inhalers. At least one at home, one in the car, one at work, wherever your work is. Here's the caveat. Your partner should also have a separate one. I'll never forget this happened. I mean, gosh, it just this happened in my family where there was a medical emergency. Okay, someone had an asthma attack, and he knows where his inhaler is. But if you go down quickly, you're not going to have time to go and find where it is. My family member was so, and I was a child. I was like almost like traumatized by it. Oh my God. Okay, because this is an adult, somebody I looked up to in a house. In the house, just went down from asthma, and I felt helpless. Like I don't know what to do. I didn't know what to do. I knew that he needed an inhaler. I just didn't know where it was. I didn't know what to do, and saw this family member literally crawling on the floor. Do you understand how? God, I'm sorry. Do you understand how crazy that was? That's honestly one of the defining moments as to why I wanted to do medicine. Because he's always normally fine. She might always be fine, but you never know. It happens. And let me tell you, as a physician or working in the ER sometimes, the people that, oh my God, it's this family that saves these people a lot of the time. Family, spouse, neighbor, a random passerby who actually is like, oh, okay, I'm bringing my family member in. 2 days ago, they were fine. Now I was checking on them today and they're off. There's something different. That's extremely valuable information, because what if that person had a stroke? Or what if there's some things that are time sensitive? And if we know the last time that person was normal, then we can use some important medications like TPA. One nurse, Courtney, probably knows what that is. I'm sure she does. Tissue plasminogen activator. It basically helps to bust up a clot if one exists, to try and reverse the effects of a stroke. But you can only give it early on in a certain time frame. Does what I'm saying make sense? Many of you, of course, love your partners, want to support your partners. This, to me, is part of the support on a whole nother level. Okay? I could just go on and on and on. I could go on and on and on. I'm telling you. I'll just leave it at that. I'll just leave it at that. Yeah. That's what I would say about asthmatics. Basically, there should be multiple inhalers, and your partner should also know or keep one as well. Okay, and be also help you, because when you're going down, you won't be thinking the same. God forbid should that happen. Okay. So thanks, guys, for rocking with me through that, but I just had to make that point. Okay. All right, so to be Black native, drinking hibiscus tea, banana for high blood pressure, berry juice with apple, beets, and carrots almost daily for combat flu-related symptoms. I also take vitamin D3 with ginger tea. Okay, wonderful. You know what? Mother Earth has a diversity of resources that I think we need to tap into. And I think in a modern society, we're getting a better understanding of these natural herbs and supplements. I do have sometimes some concerns with them, because these things have not always been FDA studied or regulated. So sometimes we don't know the the unanticipated side effects or consequences of these things long term. However, I've had a lot more experience with patients telling me this does work for this issue. So I would just always say, approach with caution, but if things work, they work. And of course, we get our medications a lot of times from Mother Earth. Like we literally will harvest plants and extract elements of plants to help formulate medication. So, I'm not surprised. I'm not surprised. So thank you for sharing that. The other thing is vitamin D. Yeah, vitamin D is extremely important. Vitamin D is extremely important for calcium and bone health for a lot of reasons. People who have kidney disease, they oftentimes have impaired activation of their vitamin D. So, I always have to bring it back to kidneys, actually. So if you want more information about like the physiology of vitamin D and calcium, I can go into that too, because that's literally what we do. And why is bone health important? It reduces risk of fracture and helps your quality of life. We do know that with studies that if you have a fracture, there's actually increased risk of, your quality of life going down, obviously. And there's a lot more data about that. But yeah, thank you for sharing. Thank you for sharing what works for you. Of course, all of those things, I would encourage you to see the doctor, even if you take natural herbs and supplements, for any reason. You want to see that those things work on your blood pressure or whatever you're intending it for, number one. And number two, you want to just make sure that there aren't any potential side effects on liver, for example, on kidney, for example. Yeah, I've seen some herbal supplements that have these like Chinese herbs called aristocolic acid, if I'm not mistaken. I may be pronouncing it incorrectly, but it's been implicated in kidney disease and actually urothelial cancers, like, urologic related cancers. So that's my only concern. I've also seen drug related, meaning like herb supplements related liver disease that actually caused liver failure and death in somebody. So, again, I go back to what I say, Mother Earth has a lot of resources that we need to tap into. But, with caution and, definitely still see your doctor. So thank you for sharing that, to be Black Native. Hey, Tony Robinson, thanks for joining us. Okay, so you just had your first dose of Moderna. Okay. I applaud you. I support the vaccine, of course. Yes. Oh, it was for going to sleep, the alcohol related to going to sleep. Can we talk? Can you IG me or DM? I said IG me. DM me for sure. Now, if you are just joining the channel or the live today, make sure to like on your way in, hit the thumbs up, and subscribe if you haven't already, okay? I'm just saying. I want to grow this channel and I want your support. Okay. Beautiful Kimmy. Oh, I missed the live after rewind. Oh, no, you didn't miss it. You're here, but definitely catch the replay for sure. I missed you, beautiful Kimmy. Thanks for joining us this afternoon, okay? Yeah, I was thinking about you just the other day. Oh, thank you so much. Okay. Sometimes I've been falling asleep on my Chromebook. Me too. And YouTube wakes me up out of my sleep with those notifications. I'm so tired of YouTube and their I'm actually tired of YouTube and their so many ads. Although I love YouTube because I'm on their platform. But yeah, I'm right there with you. You know what? We can do a topic about sleep hygiene. It's not as easy. If you're not already doing that, it's not as easy as you think, So I'm happy if you're interested or anyone else is interested, I can do a whole video on sleep hygiene, why it's important, like the data behind it, the impact on the body and all of that, and then also how to actually do it. For example, one of those things is to not have a TV in your bedroom. A lot of like sleep doctors actually say that the bedroom is only for sleeping and sex, period. So, sometimes having that stimulation and that, for example, light, sound, noise from your laptop, those things can, you might seem fine, but actually inhibit, your restfulness and and the quality of your actual sleep. It's not just about how much time you're sleeping, but it's, are you having a restful sleep? And what was I going to say? Do you have interrupted sleep? The stop in, waking up in the middle of the night multiple times is so damaging. Oh, to your restfulness. And all of us need to be, that literally should be a priority. That is part of self-care, by the way. You would want your pilot to be well rested and alert and happy and engaged. So you should want that for you too, right? LSW says so true, right? Okay, to be Black native, I can attest to what happened to you and your family member, right? Because a similar situation occurred with her 9-year-old daughter. Yeah. And luckily there's at least support. There's someone there to at least, try and help. But yeah, these situations happen all the time. Yeah. My best friend's daughter. Oh, okay. I will DM you about some other concerns, of course. I got you. Okay, so last call. If you want to call in or comment, please do so. If you haven't already, like this video, thumbs up, share and subscribe, and definitely follow me on Instagram at Dr. EVIEOA, listed right there at the bottom, DRIVIEOA. And, I got a lot of stuff in store for you, medical mysteries, especially for those of you who are in healthcare, have an interest in healthcare. And I'll give you a little tidbit right here, right now. Can you believe it? My first job in healthcare was as a CNA. I think I shared that with you before, right? A CNA, Certified Nursing Assistant. The assistant to the nurse. Not a nurse, assistant to the nurse. One of the best jobs, honestly, one of the best jobs. And, it definitely influenced how I relate to patients, for sure, because I was taught by some incredible nurses. So, I got a lot of respect for anyone really in the healthcare field. So anyway, hopefully you found this to be helpful and enjoyable. I want to see if you have any other thoughts or questions for me. Additionally, in the next couple of weeks, we're going to be getting more into, like more relationship and healthcare issues. A lot of that is going to be the relationship with yourself, relationship with others, relationship with your spouse as it relates to your healthcare. So I'll break it down and make that really clear. But part of it was demonstrated today that you yourself are worth it. Your relationship is worth it and can really be an asset to you. And I want you to be empowered and inspired to encourage participation in your own life, in your own healthcare life, and hopefully it trickles down into other areas or other aspects of life. So I'm excited. And then in the next couple of weeks, we're gonna have some fun. I want to just get to know more of what your needs are, what you're looking for. But I think this channel is in for a great future. Okay, so thank you so much for joining. We'll see you next weekend. Okay, bye.